Yep, there we go. All right, we are live. Thank you all very much. Welcome to the penultimate budget hearing for the Health and Social Services Subcommittee. We will be doing the budget for the Social Services Administration of the Department of Human Services today. Again, as always, a reminder, we are live, and everything we say, do, or type will be live as well. Just a reminder to everyone, the process, we will start with our budget analysts, Sam Quist, move to the department, and then move to witnesses. I don't remember, are we starting with the audit or are we starting with the budget hearing?
We're starting with the budget hearing.
Okay. Is there a response from the department to the audit as well?
Not that I have received. I'm not sure if someone from OLA could respond to that question.
No, we haven't received anything.
All right, sounds good. Then we will go ahead and start with the budget, and then unlike just about every other budget hearing we've had this year, we do have a report from the Office of Legislative Audits about the Social Services Administration as well. It was their time to be reviewed. So we will go through the budget, we'll go through the questions. I believe we have 3 oral witnesses signed up and a few other written. And then we will go after that to the report from the Office of Legislative Audits. One final note, I may have to drop off for a budget hearing in Ways and Means in a few minutes. I will be on as long as I can. And then after that, I will hand it over to the Vice Chair, Delegate Valentino Smith. So with that, why don't we go ahead and start with Sam's analysis.
Thank you, Chair Resnick. Let me just share my screen as always. Can I have the ability to share screen? It's not letting me.
Yes, my fault. I just did it.
That's okay.
That works for you now.
All right, great. You all should see the DLS budget analysis document for the Social Services Administration within the Maryland Department of Human Services. The fiscal 23 allowance is $653.3 million. This is an increase of $15.3 million over the 2022 working appropriation. And the increase is mainly in the foster care maintenance payments program. I'm going to start the presentation with the performance analysis section of the document. The first exhibit is showing data on child maltreatment reporting, which has been significantly impacted by the COVID-19 pandemic. Between February and April of 2020, the number of child maltreatment reports declined by about 60% and has remained below pre-pandemic levels ever since through August of 2021, which is the most recent month that data is available for this analysis. This corresponds to the closures of in-person schooling, childcare, medical visits, and other reduced opportunities for in-person contact between mandated reporters of child abuse and children. Following April of 2020, there was an increase in general between then and about March of 2021. However, between March of 2021 and August of 2021, as shown on the chart, the reporting again declined, and in August of 2021, it reached a point that was lower than the previous pandemic low point in April of 2020. I would note that DHS has made some data on this available on its website through November of 2021, and taking a preliminary look at that data showing reporting beginning to trend back upwards. However, due to the timing of that, it's too early for DLS to make a determination on trends regarding that going forward. There's also some data on the national impacts of the COVID-19 pandemic on the child welfare system that show that there were similar trends with this in other states. The U.S. Government Accountability Office issued a report earlier last year in which it surveyed officials from 5 other states, local and statewide child welfare offices. And they found that those states all saw similar declines in child maltreatment reporting for the same reasons as in Maryland during the early months of the pandemic. However, in contrast with Maryland, some of those states saw trends return to pre-pandemic levels in the fall of 2020 during the first return of children to school that fall. Officials in other states also noted that there were concerns of child abuse going unreported, as well as cases of more severe child abuse occurring due to those cases not being reported until the cases escalated to a more severe level that was more visible and not visible until that point. DLS is asking the department to comment on any trends in Maryland it is seeing as far as why the numbers in Maryland have not returned as quickly to pre-pandemic levels as in other states, and if they've observed any other notable trends relating to both the severity of child maltreatment cases being reported during the pandemic, and if there are other concerns in Maryland of cases going unreported for these reasons. Exhibit number 2 is showing similar data for elder abuse reporting through SSA's Adult Protective Services for vulnerable adults. And this is showing that in 2020, there were declines as well in adult abuse reporting related to impacts of the pandemic. However, in fiscal 2021, the reporting has increased. It's up about 10% from 2020 levels. However, interestingly enough, although the reporting has increased, the actual number of cases of abuse indicated or confirmed in adults has declined in 2021. That's the green line on this chart, and that's showing a decline to the lowest point within the 5 years shown in this chart. I'm going to turn ahead to Exhibit 4 in the analysis, which is showing data on both the rate of removal into foster care as well as the rate of placement moves. The rate of removal, which is shown by the blue bars on this chart, has generally been declining in recent years, and this is correlated to the department's focus on the implementation of evidence-based prevention practices under the Family First Prevention Services Act, which the analysis discusses later on. And I'll cover a little bit more in this presentation. The other factor impacting that is related to the lower rates of maltreatment reporting, which has led to a lower number of removals into care and lower caseloads during the pandemic. And then the red bar, which is showing the rate of placement moves. This has also been negatively impacted by the pandemic. There's been an increase in the rate of placement moves. And the department indicates that one of the reasons for this is related to quarantine-related issues, as well as other issues with staffing and impacts of the pandemic that are having a negative impact on stability. The analysis includes a discussion of some of the federal stimulus funding that was received by the department in fiscal 2021. There was a total of $14 million. The majority of that was $11.8 million for supplemental funding for foster care maintenance payments programming through the CARES Act and the Consolidated Appropriations Act. There's also funding for child welfare services and adult services. This was supplemental funding to respond to impacts of the pandemic. And in 2022, there's funding for similar purposes. There's about $9.7 million of federal stimulus funding coming into the budget, and that's mainly through several deficiency appropriations that are included in the budget bill this year. The largest category is again for supplemental funding for the foster care maintenance payments program, as well as funding for both child welfare services and elder abuse prevention programming to supplement that to respond to impacts of the pandemic. Exhibit 5 is showing the overview of the fiscal 2023 allowance. As you can see, almost exactly half of the budget is for the foster care maintenance payments program, about $326 million in fiscal 2023. In the other half of the budget, the main area of spending is in personnel, about $238 million. And within that, the largest department is the Child Welfare Services program. Exhibit 6 is showing the changes in the budget, and I'm going to focus mainly on the foster care maintenance payments section, since that is the largest area of increase. Within this program, there's about an $18 million increase. I believe most of that is for general funds. And the largest item of increase in here is $10 million in fiscal 2023 for provider rate increases for providers that have rates set by the Interagency Rates Commission, or the IRC. And I'll talk a little bit more about rate increases later on in the presentation. The other large increases are $7.3 million for flexible spending funds. These are funds for various costs associated with foster care placements. And the increase for this is due to better aligning expenses in the fiscal 23 budget with actual expenditure levels that have been seen so far during fiscal 2022. And then the next item is $5.3 million is the net increase for the placement costs for all other placement types outside of the regular family foster home placements. This increase is also better aligning the 2023 budget with most recent actual expenditure levels, which have been a little bit higher. And this is also taking into account the net impacts of the provider rate increase funding that was included in fiscal 2022. There was some lower caseload sizes so far in fiscal 2022. That's having an impact on the budget as well. However, that's being largely offset by the increased placement costs, and that's leading to an increase in the amount of spending. The other item that I would note in this chart, there's an item 1.1 million that's budgeted for hospital overstay costs for youth in the hospital longer than medical necessity, which are not covered by Medicaid as a result. This is the first year, fiscal 2023, that those funds are budgeted in a separate subprogram. So those are included in there, as well as an increase in costs for those placements. Outside of the foster care maintenance payments program, the remainder of the budget increases by less than 1%. So there's not really a large change outside of this program. However, the bottom of the chart is showing the other one-time federal stimulus funding received in 2022 as a net decrease going forward. The next two exhibits are showing data on the average monthly caseload size. First, exhibit number 7, this is data for the foster care placements by placement types. And you can see, as I mentioned previously, related to the child maltreatment reporting and the rates of entry into foster care, this has been declining. The caseload size have been declining during the pandemic as caused by some of these pandemic-related impacts. So starting in fiscal 2020, there was about a 4% overall decrease. But as you can see on this chart, the rate of the decrease between 20 and 21 was more substantial than that. There was about a 15.5% decrease in overall total caseloads for this. And the data on these charts for fiscal 2022 is through December, so the first half of the fiscal year, and that's showing an additional 6.5% overall decrease in fiscal 2022. This is This is mainly due to lingering impacts of the COVID-19 pandemic. I think there was initial anticipation within DLS and in the budget for fiscal 2022 that there would not be continuing impacts of the pandemic on the child welfare system in fiscal 2022 at this point, but the data is showing that there's still been an impact on that. Exhibit 7 is similar average monthly caseload data for the subsidized adoptions and guardianship placements. These are both declining for similar reasons. However, as you can see on Exhibit 8, there's been less significant of an impact. This is related to the fact that these two placements are mainly reliant on court activity, and the court closures that occurred early on in the pandemic ended in fiscal 2021. And following the resumption of court activity, they were able to pretty much rapidly return to the placement levels through the courts for these two placement types. Exhibit number 9 is showing estimates for average monthly caseload size as estimated by both DLS as well as the estimates that the budgets are based on for both fiscal 2022 and 2023. So as you can see, as I was previously mentioning, the average monthly caseloads in 2022, the estimate that DLS has is notably lower than the estimate that the budget is based on. This is basically due to the fact that the DLS estimate is based on the actual monthly caseloads for the first half of the fiscal year through December, and the estimates that the budget is based on were those estimates from a year ago during the time that the 2022 budget was being formulated. And as a result, DLS has subsequently lowered our caseload estimates downward, taking into account the actual numbers for halfway through the fiscal year. In 2023, you can see that the DLS estimate and the budget estimate are fairly similar to each other. This is based on the fact that both DLS and the budget are making the assumption that once we get into fiscal 2023, the caseloads will have rebounded more closely to pre-pandemic levels, and there will be less of an impact from the pandemic on the child welfare system at that point, or at least the hope that that will be the case at that point in time. I'd like to talk a little bit more about the provider rate increase funding, which is shown in the next section on the bottom of page 18 of the analysis. As mentioned previously, there's a $10 million expenditure in the fiscal 23 budget for provider rate increases for foster care providers who have rates set by the IRC. 2023 is a little bit of a unique year in that there is not budget reconciliation language this year. In previous years, language in the Budget Reconciliation and Financing Acts has capped the percentage on provider rate increases. However, in 2023, this is not the case. And the actual percentage of these increases will not be known until later on in the year when the IRC makes that determination of percentages. So DLS is making a preliminary estimate of a 4% provider rate increase. That's the percentage that we used in our budget assumptions. However, I would note that since the actual percentage is not capped this year, the actual dollar amount and percentage of rate increases could be higher than that and could be actually significant because of no budget cap on those increases. The other thing, this talks a little bit about the 2022 funding for provider rate increases. There is a separate $5 million general fund appropriation, which is a deficiency appropriation that's included for fiscal 2022. That is for supplements to providers in 2022. And the analysis is asking the department to comment a little bit more on how that $5 million in supplements will be used. Exhibit number 10 is showing the increases in average monthly placement costs for the 5 categories of foster care placements that have had the largest cost increases between the 2022 budget and the 2023 budget. Purchased institutions and purchased homes, as well as emergency and treatment foster care and foster care for minor mothers and infants, are the largest placement costs that have the largest increases. As I mentioned previously, some of this increase is due to the fiscal 2023 budget attempting to align budgeted costs going forward with more of the more recent actual costs in these areas in 2022 year to date, which have been increasing over the numbers that were budgeted in the 2022 budget. And taking this into account, exhibit number 11 is the DLS forecast for the foster care maintenance payments program, taking into account those estimated expenditures in the budget, as well as the estimate for caseloads going forward. DLS is estimating that there will be surpluses in both 2022 and 2023 of 6.4 million and 8.7 million. And we are estimating that the largest share of those surpluses will be in general funds. The 2022 surplus is based on having there being actual lower caseload numbers through the first portion of the fiscal year compared to the caseload estimates that were based in the budget, despite the fact that the caseload average monthly placement costs have been increasing. We are estimating that because the caseload size has been lower, there will ultimately be a surplus at the end of the year. In fiscal 2023, the analysis does note that this is a preliminary estimate and the ultimate amount of surpluses could be impacted by the actual size of provider rate increases, the actual size of caseload increases throughout the year, as well as the ultimate availability of federal Title IV funding. Due to these uncertainties going forward, DLS is not making any recommendations regarding reducing funds due to these surpluses. However, we are recommending annual budget bill language, which restricts the general fund portion of this program funding to that purpose. So if there are ultimately large surpluses at the end of the year, that general funding would revert back to the state's general fund. The personnel data section on the next page, there are a couple items I would highlight. The first is there's an overall net decrease of 2.77 positions. This is taking into account position abolishments as well as interagency transfers of positions across departments. The other item that I would note on this page is the vacancy rate. At the end of calendar 2021, there were about 342 vacant positions agency-wide, which was 13% of all agency positions. This was about 158 positions higher than what would meet the turnover expectancy, and was an increase of over 100 additional vacant positions since that time 1 year ago. The largest category of these positions are in the Child Welfare Services program. I'll mention a little bit more about that in the issues section related to caseload to staffing ratios. But I'm going to turn to the first issue in the analysis now, which is related to hospital stays for youth and out-of-home placements. Exhibit 13 is providing data on the average length of stay for youth who were admitted to the hospital for both medical and psychiatric inpatient admittances. As in prior years, language in the fiscal 2022 budget bill restricted funds in SSA pending the receipt of a report on this data for youth and out-of-home placements in the hospital, as well as data on medical overstays. The report was submitted at the end of the year, and funding was ultimately released, and it contained a variety of data. The first was the average length of stay, which is shown in exhibit number 13. There were a total of 231 hospital admissions for medical reasons and 235 hospital admissions for psychiatric reasons between the time period of October 2019 and September of 2021. And the average length of stay varied between 35 days for medical hospitalizations between October of 19 and December of 2020, and 19 days between January of 2020 and September of 2021. For psychiatric hospitalizations, the average length of stay was 50 days between October of 19 and December of 2020, and 26 days between January of 21 and September of 2021. However, if you look at the overstay days longer than medical necessity, this is summarized in the chart in Exhibit 14. You can see that the hospital overstays is continuing to be an issue, and significantly more so for psychiatric hospitalizations. There were 11 youth in medical hospitalizations in calendar 2020 that experienced a total of 312 overstay days. And in calendar 2021, there were 12 youth that experienced 171 overstay days. In the psychiatric hospitalization category, there were 73 youth in calendar 2020 that experienced a total of over 2,800 overstay days, and 74 youth that experienced 1,250 overstay days in calendar 2021. This average is taken by taking the length of overstays for youth discharged in a given month divided by the number of youth discharged that month to get the average. And Exhibit 15 is showing data from the report that provided data on placement after discharge for all youth who were admitted into the hospital after release from the hospital, not just for the overstay youth, but for all the youth who were admitted to the hospital. And this is showing that after discharge, the largest areas of placements were in residential treatment care facilities, group homes, or treatment foster care facilities. On page 27 of the analysis, this contains some discussion of the annual out-of-home placement report that's published each year by the Governor's Office of Crime Prevention, Youth and Victim Services. This includes data on all of the child placement agencies in Maryland, not just DHS. It also includes data on youth placed with the Department of Juvenile Services, the Maryland Department of Health, some of their programming, as well as MSD. And the report stated that in total, there were 629 placements across all of these agencies in fiscal 2021 that had a hospital stay. This is a 23% decrease compared to fiscal 2020. However, the report is stating that this is most likely due to impacts of the COVID-19 pandemic on overall caseload size, rather than being attributable to less need for placements. The report makes the main conclusion that the providers for these services and placing agencies both agree that there is an additional need for specialized residential treatment programming in Maryland in order to address the hospital overstay issue and in order to reduce the number of wait times between referral and the placement into these services. And as well as noting that there is an additional need for the availability of high intensity placements, such as through residential treatment centers, which have generally been decreasing over the past decade. The report notes a couple of actions that have been taken to address this. One of these is in the Maryland Department of Health, which released $5 million in grant funding to providers who were developing programming specifically to address the overstay issue and children and youth most likely for experiencing an overstay. And also within DHS, they had released a statement of need for additional beds for psychiatric care for some of these youth. There's been additional impact through the Family First Prevention Services Act, which is the next issue in the analysis that relates also to the overstay issue through the effort to develop more evidence-based prevention services to prevent the need of youth for needing to be placed in these services, as well as the designation of qualified residential treatment programs in Maryland to provide some of these services to youth. So exhibit number 16 in the second issue of the analysis, this is showing the evidence-based practices approved by the DHS state plan for under the Family First Prevention Services Program, as well as data on the number of families served through these 5 programs. There were an additional 3 programs that the Department of Human Services included in its state plan. However, they were not rated by the National Title IV Clearinghouse as being supported for federal reimbursement at the time the plan was submitted. However, subsequently, 2 out of those 3 were rated by the clearinghouse at a level that would be satisfactory for receiving federal reimbursement going forward. So there's a total of 8 practices altogether that DHS has indicated that they are implementing. Just a little bit of background. The overall goal of the Family First Prevention Services Act is to extend flexibility on the state uses of federal Title IV funding to allow for this to be used in addition to its other purposes for paying for foster care, placement costs, also to be able to be used for reimbursement for evidence-based prevention services. The goal is to provide in-home services to families and children wherever is safely possible in order to support the maintenance of children in their family home rather than removing them into foster care when that can be avoided. The other large portion of the Family First Prevention Services Act is related to the qualified residential treatment programs. This is a provision of the act that limits the federal reimbursement for non-family based out-of-home placements in order to incentivize children to be placed in the least restrictive and ideally family-based settings whenever possible. And these are limited to 2 weeks unless the placement is in a facility designated as a qualified residential treatment program or QRTP. DHS has worked with the Department of Juvenile Services on developing a QRTP designation process in Maryland and has indicated that at the beginning of the year, the first of these providers have been designated in Maryland. However, there is still a cost allocation plan that DHS has submitted that is still pending under the U.S. Department of Health and Human Services. So the analysis is asking to provide the department to provide a status update on where the state of Maryland is with the designation of these providers, as well as the ability to seek federal reimbursement for those. In order to qualify for a QRTP, a facility has to generally meet some criteria, including using a trauma-informed model of care, as well as meeting other national accrediting standards as approved by the U.S. Department of Health and Human Services. The other graph in this section of the analysis is showing the overall spending on evidence-based practices funding. You can see there was more variation between the years of 2016 and 2020. This is while Maryland was operating under a Title IV waiver prior to the actual implementation of the Family First Prevention Services Act. Since fiscal 2021, funding has been more stable, and in 2022 and 2023, is almost entirely relying on federal funds. However, DLS notes that even when practices are eligible for federal reimbursement, there's generally still about a 50% matching fund requirement. So DHS is also asking, DLS is asking DHS to comment on that funding plan going forward to meet that federal match requirement. The next issue in the analysis, which I'm just going to touch on briefly for the sake of time, this is related to the end of the federal moratorium on youth aging out of foster care, which expired on September 30th at the end of the federal fiscal year. During the pandemic, there was a moratorium first at the state level, which was then followed by a national moratorium implemented in December of 2020. This included a couple of different notable flexibilities for older foster youth. The first was extending the eligibility for older foster youth to receive services through age 2026, or age 26, sorry. The other flexibility was flexibilities on the work and education requirements, generally for the Chafee program funds, which are the main federal funds used for programming for older youth. There are education and work requirements in order to receive services under that program. The flexibilities under the moratorium temporarily suspended those. So if a youth receiving services had their education or work interrupted by negative impacts of the pandemic, that would not impact their ability to receive services. There has been a bill introduced in Congress seeking to extend some of these protections from the national moratorium. It's been passed in the U.S. House of Representatives. However, its status is still unknown in the Senate. And because of that uncertainty going forward, the analysis is asking DHS to comment on services that they are continuing to provide older foster youth in light of the expiration of that moratorium. The next section of the analysis, I'm not going to cover this in detail since the auditors are here and presenting at this hearing, but I would just note that there's a summary of the audit findings included in the appendices section at the back of this analysis, and DLS is making a recommendation in the budget to restrict funding until OLA submits a report indicating that DHS has addressed the audit findings in OLA's audit. The final issue in the analysis is related to caseload to staffing ratios. Data is annually provided by the department to DLS on staffing and caseload ratios, and this is shown in Exhibit 18 for staffing data as of September 1st, 2021. The first column is the number of filled case worker positions needed to meet the caseload to staffing ratios set by the Child Welfare League of America, which was 905.6 positions. And the second column, filled worker positions, is the actual number of filled case worker positions that DHS had, which were about 1,188. So this is indicating that DHS is currently meeting those caseload to staffing ratios. However, DLS is noting that this is impacted by the lower overall foster care caseloads during the pandemic that I previously discussed, which is causing there to be less overall numbers of filled positions needed to meet those standards. And DLS is noting that although standards are technically currently being met due to the high number of vacancies throughout the department, going forward, if the caseloads for foster care were to rebound and grow towards pre-pandemic levels, as we are anticipating that they eventually will, that would require additional numbers of workers filled positions needed to meet continue to meet caseload standards. So we're asking the department to comment on efforts to continue to address the high vacancy rates in order for them to be able to continue to meet caseload to staffing ratios in future fiscal years. Finally, I'm going to briefly go through the DLS recommended actions. There are 8 recommended actions. Some of these were previously addressed, such as the first one. Again, this is language restricting funds in the budget until OLA issues a report indicating that audit findings have been addressed by SSA. The second recommendation is the annual narrative providing updated data on the hospital stays and hospital overstays for youth and out-of-home placements. The third recommendation is narrative asking for an update on the status of the Family First Prevention Services Act activities, and in particular asking for an update on the QRTP designation status. The fourth recommendation is asking the department to provide an update on its implementation of a new foster care provider rate structure. There's a little bit more information about this listed in the update section later on in the analysis. Recommendations number 5 and 6 are annual budget bill language, which are restricting funds in the foster care maintenance payments program and the child welfare services programs to that purpose only. Recommendation number 7 is language asking for the caseload to staffing ratios, which is annual language asking for that data for as of 2022. And the final recommendation number 8, is committee narrative asking for the department to prepare a report which includes data on the impacts of economic instability caused by the COVID-19 pandemic on child neglect, including examining data on reasons for removals related to economic hardship and a discussion of efforts to prevent child maltreatment from going unreported going forward, and an overarching discussion of the fact that maltreatment reporting and caseloads continue to be lower than pre-pandemic levels and any other impacts that are impacting that going forward. But with that, I will conclude the DLS presentation. That concludes my presentation, and I can take any questions.
Thank you, Sam. Let me see. Are there any questions from the subcommittee members? Okay, Delegate Henson, please proceed. Delegate Henson, we're having a hard time hearing volume on you.
Oh, no. Let me try to speak a little louder.
Here you are.
Thank you.
We got you.
Thank you, Madam Chair, and thank you, Sam, for the thorough analysis of the department's budget. Specifically, page 11, you gave us an overview of the federal stimulus funds that came to the department in FY21. Do we know if those fund balances were spent down or what the status of them are?
Turn to that page. That's a good question. I don't believe that the budget, actually, we would have that data in the closeout data for fiscal 2021 at the end of the year. I don't have that offhand in front of me, but we would have that data. It would indicate at the end of the fiscal 2021 if there was any unspent funding remaining. I could look into that and get that for you.
Thank you. I don't know if we do any quarterly analysis or biannual or anything to kind of keep on target with what the funding is and how effectively we're meeting our goals there.
So there were, I believe DBM was issuing some reports on the coronavirus relief fund. So I think that would be the CARES Act money specifically. So there may be information from some of the DBM reports on that. I also know that the Comptroller of Maryland was also issuing some reports, and they held a hearing specifically related to DHS for the federal stimulus funding. So there might be some more data in those reports. I can find those for you also if you'd like to look at those as well. But the DBM, yeah, I think DBM was doing some tracking, now that you mentioned that, on the spending of federal stimulus funds. So they might indicate in some of their reporting whether there was unspent funding or how that was more detail on how that was allocated.
Thank you, Sam. A follow-up on that, I think, would be really helpful for the committee. I know that some of the funding that's there, it's to be implemented for some purposes that we have been discussing with the department ongoing. So we're really interested in understanding how the additional funding has allowed the department to meet some of those goals, perhaps even more quickly. So the follow-up would be most welcome.
Sure. Yes, I can follow up on that.
Thank you, Sam. Thank you, Madam Chair.
Thank you. Thank you, Delegate Henson. And we'll also hope that the department might be able to give you some insight on your question. Are there any other questions from the subcommittee? So Sam, I want to thank you too for a very thorough report. I think we take a lot of reports, but it's clear that with respect to the situation that you cover here for child welfare, foster care, adoptions, and the vulnerable, that they don't have as much of a voice. And unless you're bringing it to us in your analysis and the things you point out, it's sometimes hard. So I really appreciate you giving voice to them in the analysis that you do. So I did want to just ask you one question. So on page 22 in personnel data, you pointed out to us that it looks like now there's 300, am I looking at this right? There's 342 open positions for the department?
Yes,
So
that's
then,
correct.
So then help me understand an Exhibit 18, which is the child welfare position status. So that does not relate to the 342 number, does it? Is that statewide personnel? And then are these different openings?
Yes, in Exhibit 18, those are just the caseworker and supervisor positions within the Child Welfare Services Program. So that 300 number, that's total for the agency-wide. So that also includes like the adult services staff, some of the administrative staff. That's total staff in all areas.
But does that include this? And so let me just run through an example. At the bottom where it says the surplus shortfall, statewide is 283. Is that 283 included in the 342 or?
Yes, that should be included in the 342. Yes, that should be included in the overall vacancy rate.
Okay, so that would mean that the majority of the 342 are child welfare caseworker positions.
Yes, the majority of the vacant positions are in the child welfare services area.
So, and then let me just run through one line with you then. So I'm going to be kind of parochial and use Prince George's County since I'm from there. So in Prince George's County, and the first thing, the 109.8 is the field worker positions needed to meet the case worker. What's the CWLA?
Child Welfare League of America.
Okay, so that's like a gold standard or something.
Yes, they're the organization that sets the standard for caseload to staffing ratios that has been designated by the General Assembly as the ratios to use for the standard to look at.
Okay. And so in Prince George's County, under field worker positions, we have 114.
Yes.
That means, so we're a little bit above what the
yes. So
Child Welfare League of America. So why is there a 4.2? I mean, I don't know if you know. I'm trying to figure out the 4.2 and 16.5 then.
So the 4.2 would be just the difference between the first two numbers. So it's showing that there's 4.2 filled positions over required to meet the standard. And then the 16.5 are the number of vacant caseworker positions within Prince George's County.
So
I don't
then
think
really-
those are,
So where you say surplus shortfall, the 283 doesn't mean that we need 283. It's the 155.7 is the amount of
Yes.
caseworkers statewide that we need.
yeah, the 155 is the number of vacancies. The 283 is the number of filled positions that are greater than the number that required to meet the standards. So that's showing there's 283 positions filled that's basically the difference between the 905 and the 1188. So it's the same thing as for Prince George's County. There's 1,188 positions total for caseworkers that are filled across all counties. But the number that would be needed to meet the standard is only 905. So we have a surplus of about 283 filled positions. But there are still 155 in total that are vacant statewide.
Positions. Okay, so we need.
Yeah, so that's just the caseworker. The other portion of the chart to the right is the supervisory positions, that's a different number.
Is that 27 then? If I'm
Yeah, so
interpreting correctly?
there's an additional 27 vacant for those. Yeah, so
Okay.
that
then-
should equal the 200. Well, actually, there's other administrative positions as
Right,
well.
so then the 342 means that we just subtract whatever 155 and 27 are from the 352, and then that tells us the other vacant positions. Okay,
Yes, I believe so. That would be the other administrative positions and other positions in other areas.
thank you. I don't normally do math out loud, especially in public. Should
I try to
probably-
avoid it also.
Right, so probably stop now.
Yeah.
Okay. Thank you. Thank you, Sam, again, for bringing voice to these important issues for people that can't otherwise testify to us. All right, we're going to move on to the department then. And so for the department, we have, let's see, Secretary Padilla, and it looks like you're going to, it sounds like you're underwater to me. Hold on. Does it sound like that to the rest of the committee? No.
No.
Secretary Padilla?
I can hear you.
Okay, we can hear you now. All right. It looks like with you today, I have Greg James, Nisana Cabret, Mr. Stafford, and Denise Conaway, and Mr. Waite. Is that your full panel? If you want, you can proceed in the order that you prefer.
Thank you, Vice Chair Valentino Smith and members of the committee for the opportunity to discuss the FY 2023 budget allowance for the DHS Social Service Administration. And thanks for introducing my team. I do have Marva Sutherland. She is the DHS Inspector General, in addition to the staff that you mentioned, and also Paul Cachepanos, Audit Compliance Social Service Administration. I want to take the time to thank Samuel Quist for his comprehensive analysis. He's a pleasure to work with, and we have.
You know what, Madam Secretary, hold on just 1 minute. I don't think the department submitted a response to the audit. I'm just wondering if I should have the auditor go and then take your. June, did the department submit a response?
Madam Chair, yes, actually they did. It was included in the testimony that they uploaded for the budget hearing, and I did forward it to OLA. So they did actually provide a response.
So do you think we should have?
Madam Chair, I think you're muted.
Sorry, I'm just wondering, sorry, Secretary, if we should have OLA, oh, this chair's back, he can maybe make that decision. If we should have OLA go first, and then the department can do a complete response to both the SAM's analysis and the OLA findings. Do you have a preference, Mr. Chair?
I'm sorry, what are we doing?
So the depart-
I just
Sam gave-
turned on the volume. Sorry.
all right, Sam gave a very good and thorough analysis, and we asked him some questions. So I called the department up, but I realized that the department also may be going to respond to the OLA audit at the same time, and I did not have OLA go yet. So I was thinking maybe OLA should just present their report, and then we can have a complete response from the department.
Yeah. Secretary Padilla, what is your preference?
It's really, I have no preference. It's your call.
Okay, sounds good. Thank you all for putting up with me. I was gone longer than I'd wanted to be gone. When the other committee says your bill is next, that means you have to sit through the bill beforehand, and that could be short or long. So I apologize for being out. Is it safe to assume that we have just done the analysis, the report on the analysis?
And question.
And questions. All right, great.
And then I called the department.
Why don't we go ahead and hear the report from the Office of Legislative Audits, then we'll have a complete, actually, you know what? No, because we have witnesses waiting to talk on the budget. And so why don't we go ahead and do that? We're going to go ahead and have the department respond to the analysis. We'll do the 3 witnesses, and then we'll go to the Office of Legislative Audits.
Right, so just have the department hold their response on the audit. Okay.
That's fine, yes. So Secretary Padilla, go ahead, please. The floor is yours.
Thank you. Thank you, Chairman Resnick and members of the committee for the opportunity to discuss the FY 2023 budget allowance for the DHS Social Service Administration. As I have stated, I have my team with me today and also available to answer any questions I have for staff who had HHR's audit compliance Social Service Administration. I want to take the time to thank Samuel Quest for his comprehensive analysis. He is a pleasure to work with, and we appreciate all his support. I also want to especially thank the dedicated social workers and staff in social services and our 24 local departments. March is National Social Work Month. The pandemic created unprecedented challenges, especially in child welfare and adult services. Our workers met and overcame these challenges to ensure that critical services continue for children and vulnerable adults. You have my written testimony, which I won't repeat here, but I will share a few quick highlights. As of December 31st, 2021, we have more than 4,300 children in out-of-home placements. The majority of the children, more than 3,000 actually, are in family care settings. The other youth are placed in group homes, independent living, residential treatment, and other settings. Since 2015, over 11,000 children have exited foster care and safely returned home, moved to guardianship, or been adopted. In fiscal year 2021, 794 children achieved permanency. 478 children were reunified with their families. 145 children went to a permanent guardianship home, and 171 children were adopted. This represents 77% of total exits from foster care and an 11% improvement over the fiscal year 2008 rate. With the pandemic easing and access to the courts increasing, the department is now able, once again, to aggressively pursue permanency for the youth in our care. We continue our implementation of Family First and our transformation of child welfare system to focus on families. We're building a prevention-based approach that emphasizes partnering with children and families. Our transformation has 3 priorities. First, enabling families to access evidence-based prevention services to keep them safely together. Establishing qualified residential treatment programs to provide high-quality therapeutic intervention for youth who need short-term residential care, and implementing the new assessment process to determine the appropriate level of care for children and youth who are entering care. The department also provides vital services to aging and vulnerable adults. In 2021, the Office of Adult Services conducted adult protective services investigations, served as guardian to vulnerable adults, provided in-home aid services with Project Home, help clients remain in their home and avoid costly institutional placement, and provided case management to support to vulnerable adults through the Social Services to Adult program. Many times when we think about SSA, we forget that there's that other piece, adult protective services. And finally, in 2021, we deployed the new adult services module for CGMs, the Child, Juvenile, and Adult Management System. Adult Services never had a dedicated data system. They have managed with paper files, ad hoc spreadsheets, and similar make-do solutions. With CDMs, adult services caseworkers are now able to use this mobile platform to deliver services and ensure continuity of care. That concludes my opening remarks. Now, with your permission, I will make the recommended actions and issues in the analysis. The DLS analysis contained 8 recommended actions. The department concurs with all recommendations. Turning to the issues, in response to issue 1 regarding trends in maltreatment, reports and child welfare caseloads, and observations on the severity of cases in Maryland, we are seeing a return to pre-pandemic levels of reports for suspected child abuse and neglect. The trend appears to be directly related to the return in-person learning for school-age children. It is premature to reach conclusions on any trends, comparing this data with previous year's data. In Maryland, CPS investigations are not categorically rated by severity, so we are unable to comment on trends related to case severity. We will continue to monitor these cases and trends. In response to issue 2, regarding the department's steps to reduce the rates of victimization for youth in foster care, we're very concerned about that rate to children in foster care. DHS believes that the higher rate of victimization is driven by incidents of maltreatment, which occurred before the youth entered care, but are only disclosed after the youth is in care. DHS is working to better distinguish between the date of incidents versus the date of report. 98% of children in care did not have a recurrence of maltreatment within 12 months of the first occurrence. DHS is committed to the safety of youth in foster care and takes measures to reduce the rate of their victimization. Communication is critical, so DHS uses a variety of channels to engage and maintain contact with youth in care, such as text messaging, social media, virtual meetings, and of course, face-to-face meetings. Caseworkers are trained as coaches who partner with youth to empower them to voice their concern and experiences. We want to continue to give them avenues so they can to express and share their experiences with us. We will continue to monitor the data to discern the cause of the increase. In response to issue 3 regarding placement stability, we're committed to making sure that our resource parents have the necessary resources to care for children and youth in our out-of-home placement and thereby reduce the risk of a placement move. We have produced the newest version of the PRIDE resource parent training. We believe the PRIDE training will better equip our resource families to appropriately care for our children and youth in out-of-home placement, and will also help maintain youth in the least restrictive environment. DHS staff are also being trained with additional skills and are being equipped with specialized tools towards placement and stability. In response to issue 4, regarding how the department plans to distribute the $5 million provider rate supplements, the department plans to distribute these supplements as one-time only grant to all providers whose rates are set by the IRC based on the provider's fiscal 2023 capacity. In response to issue 5, regarding funding for foster care payments, we concur with the analyst's recommendation to restrict the general fund appropriation for this program for that purpose. In response to issue 6, regarding the status of the approval of the cost allocation plan or CAP, DHS received from the Federal Administration of Children and Families on the cost allocation feedback in April 2021. DHS provided an updated CAP, and we received additional questions from ACF in January 2022. DHS has responded to the January 2022 questions, and we're now waiting the final ACF approval. In response to issue 7 regarding state match funding for evidence-based practices, DHS will work with the Department of Budget and Management to address any state match funding needs if necessary. In response to issue 8 regarding DHS and DJS collaboration on the designated or qualified residential treatment providers or QRTP, DHS has worked collaboratively with the Department of Juvenile Services to designate providers as QRTPs. The first applications were considered in October 2021. In the first round of reviews, 13 providers that applied and 6 were approved. DHS, in conjunction with DJS, is providing technical assistance to the 7 other providers so that they can also be approved. In addition, training for qualified individuals to perform the required youth needs assessment for placement in a QRTP is scheduled for late March 2022. Full implementation for QRTP is scheduled for June 1st, 2022. In response to issue 9 regarding efforts taken to support older foster youth following the expiration of the national moratorium out of care, DHS is committed to supporting older youth beyond the expiration of the national moratorium and has a comprehensive aftercare approach that supports all young people in their lifelong success. DHS staff are supporting youth with voicing their priorities, fostering permanent families as identified and defined by the young people, assisting with the building connections and improving their overall well-being. We have launched the My Life website, which provides youth with improved access to information and resources. And I recommend that whenever you have some free time, you might want to go and bring up My Life. It has a lot of good information for the youth. In response to issue 10, DHS concurs with the analyst's recommendation to restrict the funding in SSA pending an OLA report on our corrective actions to address repeat audit findings. In response to issue 11, efforts to fill vacant casework and supervisory positions, the department consistently worked with the local departments of social services to streamline recruiting and retention of child welfare casework and supervisory staff. As part of the effort, the department has established a vacate and fill policy for caseworkers' positions, which gives local departments the ability to begin recruitment as soon as a current employee provides notices that they're leaving. The caseworkers and social work positions are posted on an open and continuous basis, allowing the department to continually hire as needed. But from the conversation that we just had and the analyst report, it is evident that with the caseload numbers as they are today, we do have enough workers to provide the services. As a matter of fact, we are exceeding the Child Welfare League of America standards. That concludes my testimony and response, and I'm happy to address any questions regarding to what I just said, and I reserve my comments after the audit presentation.
Thank you, Madam Secretary. Are there any questions for the department? Start with Delegate Valentino Smith.
Thank you. Thank you, Madam Secretary. I think this might be one of our last budgets with you. Is that correct? And so
It's the last one.
So for over the years, I want to thank you for the work when we've had legislation that we worked on together in this area where you've been able to help us get to the point where we can move forward to address some of the issues. So thank you. And thank you for your work. Help me understand real quick with foster care. You've told us a lot and the analysts told us a lot, but with the ending of the emergency status, I mean, foster children were allowed to stay, right, during the emergency. What's happening now and how many children do you think are impacted? And what's the timeline for those children exiting foster care now?
I believe we're referring to the youth exiting care. I'm going to have my Executive Director for Social Services Administration elaborate on my response on children.
Thank you for the question, Delegate. For youth that are exiting care, we've returned to the moratorium after the moratorium that they exit at the age of 21. We're still supporting those youth with our aftercare services. We have the ability to ensure that they get continued assistance through Maryland Medicaid assistance. They have resources that's described on My Life website that they can use for assistance with things such as mental health services, housing services, and things of that nature. As you know, we have a foster care ombuds that is here at the Department of Human Services, and that is a connection to youth who are exiting our care. We have the education and training voucher that supports their education services. So those things will continue.
When did the moratorium end then?
I believe the moratorium ended in the fall of 2021. I can get you the exact date.
Okay, I thought you continued it longer than that, but you can let me know the date.
Sure.
Thank you. Mr. Chairman, just one other follow-up question then. You said that right now your last piece of testimony was you think you have sufficient caseworkers in each of the jurisdictions, notwithstanding the 352 vacancies that you have open. I think it was page 18. Page 18 says you have 342 open vacancies, but I think you just stated you thought you had sufficient caseworkers.
I'm looking for well, on page 22,
Page 22, yeah.
I'm sorry. The page that you're referring, page 36, it has the.
Well, let's just start with page 22 says you have 342 open.
Yeah, there are currently 342 vacant positions, which is 158 positions greater than will be required based on turnover expectancy. 200 of these vacancies are within 287 of the 342 are within the child welfare services. But
And they're for caseworkers?
But and then if we turn to page 36, it has field workers positions needed to meet the Child Welfare League of America standards. That's statewide was 905.6.
Right.
Right. Currently, as when this report was written, we have field worker positions, 1,188.
Right.
Means that we have a surplus of 283 positions in child welfare, which is what this hearing is about.
So what's the 155 where it says vacant caseworker position?
The 155, they're vacant because we have, in essence, what this is saying is that Budget and Management has allocated more positions than what the Child Welfare League of America is saying that we need. We have the pins, so they're vacant pins.
So you don't need any, your testimony is that in each of the jurisdictions, you have sufficient caseworkers.
No, not necessarily, because we, statewide, when I'm saying statewide, we are meeting the Child Welfare League of American standards. They set standards based on the caseloads, and currently we are exceeding that number.
I understand. What do you need? What do you need caseworker wise? What is your shortage number? If it's not 155 and you have 342 open vacancies, I'm trying to understand what the need is in the Department for Caseworkers and where it is. And if you can't answer that now, you can send it back to us. But you have 342 open vacancies. You have vacancies above turnover. And then you have what you need above what the League of America wants. So you're saying you do need more caseworkers. I'm just trying to figure out how many and where.
So if I may, because it can be a very confusing right issue. If I may, I would rather get back and
Okay.
do a kind of an analysis and kind of more itemized of what is exactly what we are trying to convey in here that is confusing. Absolutely.
No, thank you. These are the children and they're very vulnerable. We want to see where the need is for caseworkers. Thank you, Mr. Chair.
Yeah, absolutely. And Delegate, you know that you and I can agree that I too want to be the voice for the children and I too care for the children.
You do. Thank you.
All right, thank you. Delegate Henson.
Thank you, Mr. Chairman, and thank you, Madam Secretary, for your responses. I would like to, in the report, I know that we're going to ask you to make a comment on the causes for the slow recovery in the child welfare cases being reported, but I wanted to know if the agency has taken any active steps to reestablish relationships with some of our common reporters and to kind of just get the word out that, post-pandemic in terms of our operations, that the agency is open and the agency is ready to receive those complaints. So have there been any proactive steps?
Yes. And I'm going to have Denise elaborate on those proactive steps.
Thank you for the question, Delegate. And so I just want to make it clear that we never closed, we never stopped our communication. We made sure that all our customers knew that our departments were operating and that we were here to ensure the safety of children. In response to legislation last year, we put up a reporting on our DHS website related to mandated reporting. And we are always willing to communicate with our constituents about child maltreatment and how to make reports to our local departments.
Thank you, Denise. And I apologize if my comments inferred in any way that the department was closed. But I understand that we had a number of schools that had to make a pivot to virtual learning. And what it says in the report is that schools is one of the primary sources for referrals. It also referenced doctor appointments happening in person with well child visits and all those different ways that the agency has connection to the community. So I was trying to figure out if, since everyone is now, returning to in-person doctor visits, returning to in-person school, trying to understand what steps the department may have taken to make sure that those relationships continue to be built so that there is a pipeline of referrals and we are identifying the children in need of services. So that was the nature of my question. Did you have any additional follow-up based on my clarification?
No, I thank you for your clarification, and I would say that we do make sure that we are open and honest and continuously communicating with those providers in which you described that our school personnel is aware of how to make reports to us. We make sure that with the issuance of the hotline that our educators were aware when that hotline was going to go online. And so we are making sure that our mandated reporters know how to stay in communication with us.
Thank you, Denise. And if the chair will permit me an additional question.
Please.
Thank you, Mr. Chairman. One of the things that I was interested in at our budget hearing last year when we were discussing the FY21 budget was what looked like a great opportunity for training and investment in the staff. When the number of cases were lower, it looked like the staff had the ability to have time to maybe add additional training opportunities and receive more support from the agency. And then looking at the 14 million that was identified by Mr. Quest in stimulus money that came to the agency, one of those things that was listed in the purposes that it could be used for is training. So I'm trying to understand if there's been any relationship between the additional time that staff has now, that the caseloads aren't as demanding, and the agency coming in with some additional training to support our staff.
Before Denise elaborate, I want to first also share with you that I'm a member of the School Safety Advisory Committee, and I take opportunity as a member to also promote the work that we do and make sure that the school superintendents, the teachers, and everybody that sits in that committee knows that we are an agency that provides services to children, and we have a lot of conversations about how we can communicate better, how we can make sure that the information gets out there to the children, to the mandatory reporters, and all of them, so they know that we're here and available for them. In regards to the comment, and because I know most of my staff is watching this hearing, I want to make sure that I make clear that they did not have extra free time. They were really very challenged with transitioning from when they were in the office to working in a remote environment, then coming back to the office, those that chose to do the hybrid approach that we're working. And they did very well with adapting to the challenges that the pandemic we all know brought to the staff. At the same time, we were deploying a number of initiatives that were geared to giving them the tools that they need to do the work effectively. I'm going to have Denise now also speak to the communication that you have with the staff, the local DSS have with the staff, to make sure that they're updated on training.
Before Denise responds, Madam Secretary, I want to make sure that I understand fully your response. Were you saying that we don't have time in the workday that we have for our staff to include training opportunities?
I'm sorry if that's how I said that. No, I'm not saying that staff does not have time. What I'm saying is that because the statement that it came that staff have free time, I'm saying that they had work to do. Training is part of the work that the staff do, right? So I don't categorize the staff doing training as having free time, or staff, because the caseload and because we're saying that we're meeting the caseload of the child welfare caseload standards, we're exceeding it. That does not translate that staff had nothing to do, right? Even if you have more staff than technically the caseload calls for, there's still work to do. and they were engaged in that work.
I apologize if there was ever a perception that me or anyone on this committee thinks that staff is not working to their fullest capacity and that staff isn't utilizing the time. My question was more on a managerial level, on an executive level, if we were building in those opportunities for training. But if it was perceived any other way, I just wanted a chance to clarify that before Denise comments.
Thank you. Denise?
Yes, thank you, Delegate. And we made sure during the pandemic and as we were coming out of the pandemic that our staff was receiving training. We paid special attention to our staff's mental health needs, in addition to the trainings that would support them in their day-to-day activities with Maryland's most vulnerable children and families.
Thank you for your response. Thank you, Mr. Chair.
Thank you. With that, I have a follow-up question, if I may. Not a follow-up, but actually a question. As you all know, I have been watching the issue of hospital overstays, non-medically necessary hospital stays for foster care kids. And I don't have any questions about the number of kids in care and that kind of thing. I think we can go back and forth and each have our own interpretation of those numbers. There will be a bill hopefully coming out next week out of this subcommittee that addresses that issue. The question that I have deals with alternative environments. I know that since 2018, I sponsored legislation to allow for the department to issue additional RFPs outside of the needs assessments to be able to open new residential facilities for these kids. In that time, I think a few attempts at RFPs have been issued and very few additional beds have been opened. When I have spoken to providers, they have all said to a T that they don't bother applying to your RFPs because the rates offered to them to open these facilities and take care of these kids are so low that they do not meet costs. And they therefore cannot feasibly bid on these RFPs. So my question is, what is the department doing to assess what rates are supposed to be paid, what are reasonable rates, and what is the department doing to raise existing rates to those levels so that we can actually have service providers meeting costs and being able to open new facilities?
I'm gonna have my Deputy Secretary for Operations address that question. He has been following and working with the IRCs. And Greg, if you would please elaborate on that question.
Thank you. And thank you for the question, Chairman Resnick. First, I think it's important to know that the Department of Human Services does not independently set the rates for any of our providers. That we are bound legally in state law by the IRC rate setting process, which is why we have pushed and worked very hard to move forward with a new, to develop a new rate setting process. And we can provide additional information. I believe there's an update in the DLS analysis on the status of that. But I would also mention that there are other providers that we utilize that are not governed by the Department of Human Services. So rates for residential treatment center are set by the Department of by the Department of Health and their processes. It is my understanding that they are working today to develop a new rate structure for RTCs that will address the very issue that you raised.
Okay. I've been hearing about the Interagency Rate Setting Commission of the Department of Health working on setting new rates across the board now for, I don't know, 6 years. I have lost all faith that this administration is actually going to give us new rates. And I guess we'll be taking up this conversation with the next governor and the next administration next year. Thank you very much. I apologize if I seem frustrated about that, but I'm extremely frustrated since 4 years ago, we authorized you at your request to be able to issue new RFPs. And since then, almost nothing has happened. So I appreciate that it's not your direct responsibility, but it is your direct responsibility. Thank you. With that, I want to move to the witnesses signed up to testify. We will start with Denise Gilmore of AFSCME, the statewide 3 council.
Good afternoon, delegates. My name is Denise Gilmore, and I'm a field director with AFSCME Council 3. Statewide, we represent 30,000 Maryland state employees and higher education employees, including the employees who work for the Social Services Administration. We are very concerned about the large number of vacancies that are currently present in the Social Services Administration. In particular, the impact that's having on caseloads. We certainly are getting reports from our members that caseloads are exceeding the Child Welfare League of America recommended standards. This happens, it feels like almost every year, but there's just a tremendous gap between what's reported in terms of meeting those standards and the actual lived experiences of our members. We're very interested in, pursuing with this committee, the department, a new methodology for calculating these caseloads and staffing ratios to meet the Child Welfare League of America recommendations. I'll just, in closing, use one example in the Baltimore City Department of Social Services and Child Welfare there. On that exhibit 18 that's been referenced on the analysis, it alludes to there being a surplus of 87 caseworkers, but cases are so high there right now that the department has had to call and ask for caseworkers from 4 surrounding jurisdictions to come into the city and help with dealing with demand there. There's a disconnect between what's reported and what our members actually experience. And so we're interested in, like many other states have at this point, really finding a good way to be a national leader on this and get an accurate assessment of the workload. That's all I'll say. Thank you for the opportunity to testify. We do have one of our members here to testify as well, Tiffany Palmer. We appreciate her getting a chance to testify too. Thank you very much.
Thank you. Ms. Palmer, please go ahead.
Good afternoon, delegates. My name is Tiffany Palmer, and I'm a member of AFSCME Local 112. I'm also a case manager specialist with the Baltimore City Department of Social Services Out of Home Services Unit. I work with foster kids, their families, and what we do is we do reunifications, custody and guardianships, and adoptions. Currently, my caseload is 23. It's been as high as 25 in this last 6 months. This is way too high. I worked in this job for 4.5 years. I was maintaining around 17 to 18 cases until about 2 years ago. When our caseloads really skyrocketed, people were quitting left and right because this work is so stressful and overwhelming with the amount of high cases. How can we really take care of our families with such high cases in demand? It's not possible. You can't really service the families to your fullest potential because you have too many families and children on your caseload. We do need immediate solutions to meet the needs of our family. Sorry about that, guys. We need to hire more staff. Target announced this week that they were raising their rate up to $24 an hour. That's what we must compete with when we are looking to hire new staff. But it's not just enough to get staff in the door. They aren't staying once they come. We also need to retain our current staff so they won't leave at faster rates than we hire people. This is the only way that our caseload can decline. I think the salaries to do these jobs should be much higher, and we need more incentives to retain staff this year. The pandemic is still out there, and our work is really stressful. They also cut our pandemic relief out. Wow. But again, We ask for your help and support. Please hear me. I love what I do and I want to service my families, but I'm crying out for help today. Thank you for the opportunity to testify.
Thank you. Do we have any questions for either of the witnesses? Seeing, oh, Delegate Henson, yes, please.
Thank you, Mr. Chair. Ms. Gilmore, the two examples that we heard today were both the Baltimore City Department. Is this an issue that's isolated to Baltimore City, or are you saying from members that it's more of a statewide challenge, the data that we have versus the experience of our workers?
I think it varies by jurisdiction. Where there is a, Baltimore City has been under a federal consent decree for these very same issues since the mid-'80s, 1980s. So I think, it's an ever-present issue in the city, certainly, but we've heard of high caseloads in other jurisdictions too. Using foster care, for example, the caseload should be around 12 to 15 families there, according to the Child Welfare League of America. And it's just, 17, 18, as she mentioned, I think between 18 to 23 cases. It's just, it's exceeding. And that's why we, would love to find a more accurate way to assess the workload, because it seems like the way that we're calculating staffing ratios per the total number of cases just doesn't quite match with the actual experience that many of our members are having.
Delegate Henson, do you have a follow-up? No.
I do not. Thank you, Mr. Chair.
All right, thank you. With that, that concludes the budget hearing. We are now going to move to the report from the Office of Legislative Audits. With us today are Josh Adler and where'd he go?
Eddie Rubenstein.
Where did he go? Oh, you're right there. There you are. Weird screen. All right, and Eddie Rubenstein. Please go ahead and present your report.
Good afternoon, members of the committee. Good afternoon, everyone. My name is Eddie Rubenstein, and I was the manager for the SSA audit. Slides 2 and 3 of our, if we could get that on the screen. Slides 2 and 3 provide an overview of the audit, and slide 4 summarizes the key findings. Our report contained 8 findings, of which 7 were repeated from our prior audit report. The number of repeats and the significance of these findings were the primary factors that contributed to SSA's unsatisfactory rating. We are currently conducting a follow-up review of the actions taken by SSA to address the audit findings and hope to report the results of this review in the near future. In the interest of time, I'm going to focus today's presentation primarily on findings 1 through 4 of our report. Starting with finding 1 on slide 5, which was that SSA had not implemented comprehensive and effective quality assurance processes to ensure that the local departments of social services, or LDSSs as I'll call them, effectively administered child welfare programs. The LDSSs have numerous critical responsibilities with respect to these programs, including placing children with providers, ensuring children receive required services such as medical and dental care, and investigating allegations of child abuse and neglect. In our preceding audit report, we recommended that SSA develop written procedures for monitoring these programs and to implement a quality assurance case review process at each LDSS. In response to this recommendation, SSA implemented periodic on-site reviews to assess LDSS performance and compliance and developed certain written procedures. However, as evidenced by several of the other findings contained in our report, we determined that these actions were not sufficient to provide effective oversight of the LDSSs. Regarding the on-site reviews of the LDSSs, we found that the scope of these reviews excluded certain critical LDSS functions, such as ensuring that safety assessments for substance-exposed newborns and children born to individuals with previously terminated parental rights were conducted in a timely manner. We also question whether these reviews provided an effective means to ensure the LDSSs effectively administered the programs. For example, as I'll explain further in the next finding, there continued to be a lack of documentation to support that foster children were placed in the least restrictive environments and received required services such as annual medical exams. We also noted that the procedures SSA developed were not always sufficient. For example, SSA's procedures provided that it was to distribute various reports to each LDSS to assist with oversight of child protective services, such as investigating allegations of abuse and neglect. But the procedures did not address how these reports were to be used to ensure that the investigations were actually done timely. Further, we noted certain inaccuracies with these reports, which precluded effective oversight. Moving on to finding 2 on slide 7, which is also a repeat finding. We found that SSA did not effectively monitor the LDSSs to ensure that foster children were placed in the least restrictive environment and received required services such as periodic medical and dental exams. The LDSSs are responsible for ensuring that children receive these services and documenting the services provided in SSA's case management system. SSA routinely provided reports to each LDSS that identified the services provided to each foster child. However, SSA did not use these reports to ensure that the LDSSs placed children in the least restrictive environment and provided the required services. The table on slide 7 summarizes the results of our test of 6 foster care requirements for 48 children who were served by 13 different LDSSs. In total, we tested 262 requirements for these children and found that SSA could not provide documentation to support that 83 of these requirements had been met. We also noted that for 47 of these 83 instances, no supporting documentation was available, even though the LDSS had recorded that the requirement was met. Lack of documentation is particularly concerning, considering that the majority of these instances related to required medical and dental exams. For example, state regulations require foster children to receive an annual medical exam. We found there was no documentation to support that 29 of the 48 children tested had received an exam within the past year, including 9 children whose last exam occurred between 18 to 25 months prior. Next, slide 8, please. Finding 3 was that SSA did not have an effective monitoring process to ensure that the LDSSs conducted child abuse and neglect investigations and assessments of substance-exposed newborns timely. While SSA distributed reports to the LDSSs to assist with monitoring the timeliness of these investigations, SSA did not actively monitor the reports to ensure that LDSSs completed them timely, within the required timeframes. In addition, these reports were not always accurate. State law requires investigations to be initiated within 24 hours after receiving an allegation of child abuse and within 5 days after receiving an allegation of neglect. The law also requires these investigations to be completed within 60 days of when the allegation is received. Our test of 20 allegations of abuse and neglect received between May and December of 2019 disclosed that 3 allegations of abuse were not initiated until 7 to 21 days after the allegation was received. Our test also found that 3 allegations of neglect were not started until 6 to 14 days after being received. And in addition, 3 of those 6 late investigations were not completed within the required 60-day period. Regarding substance-exposed newborns, state regulations require the LDSS to examine these newborns and perform a safety risk assessment within 48 hours of notification from a healthcare practitioner. SSA policy also requires the LDSSs to complete a family risk assessment within 30 days of this notification. According to SSA records during fiscal year 2019, the LDSSs received 507 notifications of substance-exposed newborns. Our test of 10 of these disclosed that the risk assessment for 1 child was performed 55 days after the notification, and the risk assessments for 4 of the children were performed between 36 and 70 days after the LDSS was notified. Moving to slide 9, finding 4 also relates to child protective services. Specifically, we found that SSA lacked adequate controls to ensure that it timely notified the LDSSs when children were born to individuals whose parental rights had been previously terminated by court order for abuse or neglect. SSA is responsible for providing the names of these individuals whose parental rights have been terminated to the Maryland Department of Health. In turn, MDH is responsible for notifying SSA of children subsequently born to these individuals. In those cases, state law requires SSA to immediately notify the applicable LDSS to provide an assessment of the family and offer services if needed. During calendar year 2019, there were 252 children born to individuals whose parental rights were previously terminated. However, as of August 2020, the required assessments had not been performed for 144 of these children. We found that the primary reason these assessments were not performed was that SSA did not notify the LDSS of the children's birth timely or at all. Specifically, SSA had not notified the LDSSs of 50 of the 144 children, and for the other 94, the notifications occurred between 7 to 19 months after SSA was initially notified. Our report also contains 4 other findings, which related to untimely and improper federal fund eligibility determinations resulting in lost federal funds, the failure to pursue recovery of overpayments made to certain providers, SSA not ensuring that adoption assistance payments funded by the state were suspended when an adopted child was removed from their adoptive home, and payments made to a state university under certain interagency agreements that were not adequately supported and in accordance with the terms of those agreements. This includes our overview of our Social Services Administration audit. I'd be happy to answer any questions from the committee.
Unmute. All right, thank you very much. I want to start with a quick question, if I may. All of these misreports, whether it's assessments or medical exams, or do we not have some sort of system that tracks these kids and is able to provide these timely notifications?
So I think the department could elaborate further, but the system we were looking at the time of our audit was Chessie. I think they've since transitioned over to MD Think. But really the crux of all our findings was that they have a system to monitor it. The system is saying a certain number of assessments or services have not been provided, and we just didn't really see any follow-up in those instances.
All right. So spending hundreds of millions of dollars on an IT system is probably not any good if there isn't a human being that actually follows up with the work. Is that what I'm hearing?
I would agree with that.
Exactly.
Right. Thank you. Delegate Valentino Smith.
Thank you, Mr. Chairman. I just wanted to acknowledge, because I sit on joint audits before Mr. Rubenstein and Mr. Adler leave, that it has been their job for so many years to sound the alarms for this very vulnerable population in the audit findings that they put before us. And audit findings through, whatever reason, be it lack of funding to the agencies, the need for more caseworkers, better, as you said, computer systems, but that there are a lot of vulnerable people not being followed. And they tell us this year after year, administration after administration, till eventually we're going to have to change our systems. And I just have to thank them before they leave for being the voice and bringing, your findings to us and trying so hard to point out what's happening with the people that cannot speak for themselves. So thank you.
I really appreciate it. Thank you, Delegate. I really appreciate your attention to this and that your action. When we bring something to your attention, you don't just sit there, you act on it, you sponsor legislation, and it really means a lot to me personally, because these findings, they're not cash receipt findings. I mean, these affect real people. And I think to a large extent, a society is measured by how it deals with the most unfortunate people in society. And if we can't help the most unfortunate people in society, then I think it's really a stain on all of us. And I appreciate everything you and the other delegates do to help protect the vulnerable.
Thank you, Mr. Adler. Please don't give up. Keep the fight up.
Thank you.
Thank you. Any questions for the auditors? Any additional questions? All right, seeing none, if we can turn to the department to get a response to the audit and the findings, that would be great. Thank you, Madam Secretary.
Thank you for the opportunity to respond to the Office of Legislative Audits 2021 audit report for the Social Service Administration. DHS is committed to addressing and resolving all findings identified by OLA in the 2021 audit report. As I share in the overview hearing testimony, we have established a new dedicated audit compliance and quality improvement unit in SSA to focus on these audit issues. We are also receiving support and technical assistance from the DBM audit compliance unit. The department's initial responses to these findings were included in the issue report, and we have provided updates on our subsequent corrective actions in our written testimony. I'm happy to speak to any other related questions you may have. Thank you.
Thank you. Any questions for the department? Delegate Valentino Smith.
Thank you. I think I would be correct if I'm not, Madam Secretary, you can correct me, but that you're supporting House Bill 1248, which I just testified in judiciary today, which will require increased reporting with respect to the child abuse cases that don't get handled in a significant amount of time. Is that correct?
We took a position on your bill, yes.
I think you took no position, which was a position, but thank you.
You're welcome. And thanks for all the good work that we have been able to do together, the delegate.
Delegate Henson.
Mr. Chairman, thank you to our team from the Office of Legislative Audits, and thank you, Madam Secretary, for the response and for the commitment to working through these findings. I wanted to try to, in wrapping my mind around how to understand the findings, just isolate it to the slide that's on page 7 of the presentation from OLA that goes into the foster care requirements and determine if your agency has been able to determine if these are compliance issues where the work that's being required is not being done, or if these are reporting issues where the work's being done, but the documentation and capturing that information is where we're falling short.
Thank you. Thank you for your question. Very good question. And when we were preparing our response to that finding, what we did find out that many of the cases that were noted were more documentation than negligence of us not doing the work. So it is reporting by sometimes the local DSSs did not report that the work had been done, but it actually the work had been done, or the paperwork was not kept in the case file. But that was what we found out when we were reviewing to submit a response that we submitted for the audit.
Comforting to hear that in your follow-up, it appears that we're having more issues of documentation and not compliance. For our purposes, I believe the report shows that we consider it the same because we have to have the information in order to measure it, in order to be able to determine, what's needed in a budget next. But from the customer service end of it, it's good to hear that in your investigation that it looks like this is a matter of us not documenting the things that we need to. And I can't help but go back to the question on training. It sounds like there's so many opportunities here to invest in the staff and to do training. And I just wanted to know if in your responses in agreement with the findings, if it's including additional training to make sure that things like this have the proper reporting so that we have the tools that we need looking at the data to make decisions on budget.
Thank you, Delegate. Absolutely. Training is always part of what we do. Ongoing, and also when we were preparing the responses and we saw the need to remind our workers that documentation is essential, that tracking the information is essential. Yes, and Denise, do you want to speak a little bit about the training that is being done on as a result of the audit finding?
Yes, thank you, Delegate, for your question and for your understanding that we are making sure that quality work is happening within the local departments of social services. And you are correct. We need to reinforce the importance of putting the documentation within the electronic case record. And to that end, we have the support of our ACQI unit and also our Office of Operations here that is with staff to show them how to put the information in our new electronic record keeping system and how to work with our providers to make sure that they are receiving the documentation so that it can in fact go into the system.
Thank you for your response. Thank you, Mr. Chair.
Thank you. All right, any additional questions? Okay, seeing none, I think we are now concluded. Just a reminder to committee members that tomorrow there will be a full voting session of appropriations, as well as I believe some bill hearings. On Monday will be our final budget hearing. We'll be hearing the Medicaid budget, and that will be the last budget hearing before we move into the decision-making process. So look forward to seeing everyone tomorrow and on Monday. And with that, I believe we are adjourned. Thank you very much.